Okay, primary sleep disorders, sleep apnea. Now, this is a big deal for a couple of reasons. One is that it can cause huge amounts of suffering that can last for decades and go undiagnosed and untreated. And so the tragedy of it is it's largely a treatable disorder. It causes significant impairment and suffering, and it's often unrecognized. And so you can see here that it affects a fairly large percent of the population, but especially after the age of 60. And my definition of what elderly means changes the older I get. But anyway, I'm on the edge right now, so it's quite a bit more in older people. And the relevance here is this. Apnea is where people stop breathing during the night. Okay? And everybody here probably does this 3 or 4 times per night. That's not unusual, and what will happen is the oxygen saturation levels will start going down, and then it'll cause you to gasp like that. Okay? And so that's no big deal, but with clinical sleep apnea, it's happening 200 to 500 times a night. And why this is so bad, there are 2 reasons. One is, over a period of years, you're getting tens of thousands of little miniature exposures to hypoxia. Now, if this lasted for a few months or maybe even a year, that wouldn't be a big deal. But oftentimes people have this for years, if not decades. And so hypoxia, decreased oxygen, it will begin to take a toll on the brain. It can cause hypoxic brain damage. And the part of the brain that's damaged most readily by decreased availability of oxygen is the hippocampus. Hippocampus responsible for the ability to learn new things, but also, as we're going to see, very, very important in mood regulation. Okay? Secondly, we have depressive symptoms. And the key here is to remember this, and that is that if depression is caused by apnea, by sleep apnea, it typically does not respond to antidepressants. Any person that has depression and daytime fatigue should be asked one question, and that is, do you snore, or have you ever known, or have you ever been told by anyone that you snore? Okay? And if they say yes, then you want to pursue and see if there may be apnea. Now, there's a lot of people that snore that don't have apnea. But when people have apnea, what's happening is multiple times during the night, they stop breathing, and then they have to gasp to catch their breath. And it's almost impossible to sleep with somebody and not notice that they have sleep apnea. Okay? And there's a lot of people who snore, but they don't know they snore. And I've had man and woman in my office, and I ask the guy who's depressed, do you snore? And he'll go, no. And she said, the hell you don't. I mean, why do you think I've been sleeping in the other room for 20 years? Everybody in the neighborhood knows he snores, but some people don't know it, okay? And I got to tell you, this is just absolutely, just very interesting. I saw this guy. He's actually one of my favorite patients of all times. He was a guy in his late 60s who was a physician, still practicing, but he had 20 years of chronic fatigue and depression. And he came in, and he'd been on like every antidepressant you can imagine, and been in psychotherapy and so on and so forth. So he came in for not a second opinion, but like a 10th opinion. He'd been trying to combat this for a long time. And so he had fatigue, he had depression, so I asked the question, do you snore, or have you ever been told by anybody you snore? And he looks at me like, oh my God. It's like he knew. And you might think a physician would know, right? He didn't know. He has sleep apnea, and he was treated for this, and his depression went away for the first time in 20 years. So, I mean, what a tragedy that I feel angry about this, that somebody didn't explore that, in the first session. Okay, so also if you have somebody who comes in, they say, I've taken antidepressants, and you really check out, make sure they've taken adequate doses for a long enough period of time, and there's no response, there should be a number of questions that come to mind, okay? And we'll go over a bunch of those today. But one of them is, if they have daytime fatigue and no response to antidepressants, then you explore sleep apnea. Now, the most common form of sleep apnea, going the wrong way here, is obstructive sleep apnea. And this is where people have a collapse of the airway. And you can see this guy on top, normal, opened airway, and down here in the bottom, collapsed airway. And what will happen then is a person will get to a place where their oxygen saturation of the blood is so low that they'll start gasping and have to gasp really loudly in order to pull air through the collapsed airway. I forgot to get this out. I think I've got a tape recording of what it sounds like with apnea. I'll get that at the break and play that for you. Okay? It's more likely to occur when people lie on their back. It's more likely to occur if you're overweight, but this physician was normal weight. Okay? It's more likely to occur if women have large breasts, which puts more pressure on their chest. Okay. Now, in terms of treating sleep apnea, there are a number of approaches to do this. The most non-elegant approach costs about $3. You buy a tennis ball and sew it into the back of your pajamas, right in the middle of the back, because most of the time this occurs when you're lying on your back. And so people can try this. They roll over at night on their back, and because it's uncomfortable, they'll just roll over onto their side. And sometimes that does the trick. Then there are other treatments as well. Where we go? This is CPAP. This is a mask that people wear over their nose. I'd say half the people that try this say it's really hard to get used to. It depends, but whether it works or not, whether they stay with it or not depends on how quickly it works. I've seen people that within 3 days, it's like, God, for the first time in 10 years, I have some energy. And some people it takes a month, and some people it takes several months. And I'm not really sure why there's so much variability from person to person. But this is a real godsend if people will stick with it. There are also appliances that you can have made by, usually by certain dentists. Will do this, or oral surgeons. It's not this kind of thing you buy at the drugstore, to keep you from grinding your teeth and stuff like that, or regular snoring. But it pulls your jaw out in a certain way where it keeps the airway open. Treatment of last resort is surgery, okay? But this is a huge deal, and it's just, again, such a tragedy if we don't really address that.